The Bo Government Hospital, you may be aware, is the second largest hospital in the country, second to Connaught Hospital in Freetown. It has about 300 beds, and on average, we see currently, during this COVID, on average, more than 130 patients per day. We have been preparing quite a lot since I came. Of course, I made some arrangement or some preparation done by my predecessors. At the moment, the hospital has two facilities for isolating patients. We have one of our friends who is also a native of Bo, who is also interested in the Bo Government Hospital. She is also a medic, currently living in the United States. So per privilege discussion, the name C19 Dignity Project came up. And I was sharing with her the constraints the hospital is facing in terms of equipment, many drugs and other materials needed to work in the isolation. Looking at the lead time from the 18th of May to the 31st of May, quite a short time for such a quantum of assistance that C19 Dignity Project has rendered to the Bo Government Hospital, the Bo District, for the treatment of COVID-related cases. We are so appreciative of that.
So today we've come to Kenema Government Hospital in Kenema District in the Eastern Province of Sierra Leone to supply medical tools and medication and some protective gear also to staff here because they've needed that for their COVID-19 response. Over the past couple weeks since we started volunteering with the C19 Dignity Project, we've had lots of requests come from government hospitals across the country, Bo, Kenema, Bombali, facilities in Freetown, and what they say is that they don't have the basic medical tools that they need to treat patients and to fight COVID. We made an appeal to the general public, including private citizens and companies and businesses. We also launched a fundraiser on GoFundMe. And in the 4 weeks since we've been working, we've been able to raise $50,000, that's 500 million leones. Part of our appeal, people have been incredibly generous, and the need is still very, very great because we have to send these supplies to different facilities across the country, but it's just really heartwarming that people are reaching into their pockets and stepping up to support our frontline health workers, because if they don't have the tools that they need, then they can't treat patients and they also put themselves at risk.
The Kenema Government Hospital is a regional hospital. As we all know, it's a 350-bedded hospital. I think it's one of the biggest in the country. We all usually see a whole lot of patients from, of course, Kenema, from Kailao, from Connaught. So we cover the region. So on a daily basis, I think from the outpatients and the triage, we see over 200 or 300 patients. That was normal days, of course. That has reduced a lot because of the COVID, of course. But usually that's the number of patients we see. Even before the COVID came to Sierra Leone, we have been making preparations. We have a very big center. It's about a 50-bedded center it was actually meant for Lassa fever, but then as the case it is now, so we have decided to use it for COVID patients. So we prepared that center. But of course, as we all know, we had the buildings but we did not have a lot of equipment to set up the room. So we had to put there some beds and beddings and stuff. Again, even though we had a building, as I've said already, we did not have most of these medical supplies and equipment. So that has been a challenge in working with, because presently we have patients admitted at the center. But basically we did not like things like even glucometer, which I have seen that you've come with. We have not had most of those things. We We had few like these infrared thermometers, but those were not enough. If there are some things that the government cannot do at the moment, I think when ordinary Sierra Leoneans come in to do that, I think that is very, very much commendable. And that is why we always are asking our compatriots, we're asking people to come in and help, to give whatever help they can. We don't have to sit and wait for the government, otherwise people are going to continue dying. So it feels really, 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 really great to be having things like this, and we very much appreciate that.